this class, we'll discuss one more important glycolysis insight. The question is why cancer cells have enhanced rates of glucose uptake and glycolysis. Whenever a tumor is present in the body, this tumor will grows rapidly, and this rapidly growing tumor will take up lot of glucose. Whenever these tumor cells are taking lot of glucose, this glucose will undergo aerobic glycolysis. The aerobic glycolysis which is occurring in the normal cells is different from the aerobic glycolysis which is occurring in the tumor cells. In normal cells, glycolysis will produce acetyl-CoA, but aerobic glycolysis which is occurring in the cancer cells, glucose will be converted into lactate. Even in the presence of oxygen, this glucose will be converted into lactate. And this phenomenon is called as Warburg effect. Why lactate is produced in more concentration? Why regular glycolysis is not occurring in cancer cells? Because the lactate which is produced by the tumor cells is acidic, is a acidic in nature. It is, it is a strong acid. This acidic nature lactate will decreases pH of the tumor surrounding medium. That means the surrounding medium of the tumor becomes acidic, acidic, acidic environment. Why this acidic environment is important for tumor cells? Because this acidic environment will causes tumor invasion. That means metastasis can occur and they will inhibit immune system. Immune system is when it is inhibited, then they can't fight the cancer cells or they can't kill the cancer cells. So tumor can grow rapidly, rapidly. And based on this uptake of glucose, we can give a non-metabolizable glucose to a cancer patient. That is an analog. This analog is 2,18F2D deoxyglucose. This glucose will be given to the cancer patient. If you give this glucose, analog of glucose, then this is taken up by cancer cells and it is not metabolized. So glucose, this analog glucose will remain as it is. Now, you can assess the amount of glucose present in the tumor by a scan called as PET scan. This PET scan is positron emission tomography. Tomography. And this PET scan with the 2F18 2D deoxyglucose will help in visualizing the tumor and they help in monitoring of the effectiveness of the treatment. And we can deduce one point is that tumors with a high glucose uptake, they are aggressive You can name them as an aggressive tumors, and they will have poor prognosis. That means tumor cells which are taking a high amount of glucose, then we can say that tumors are aggressive and they will have poor prognosis. Thank you.